Are you a new mom who is breastfeeding and wondering if it's safe to take Advil? In this video, I'm going to explain the risks associated with taking Advil while breastfeeding so that you can make an informed decision about your health. 1. Guidelines for taking Advil while breastfeeding. Taking Advil while breastfeeding should be done in moderation and only when medically necessary. If you have a headache, fever, or other minor aches and pains that can be managed with an over-the-counter medication like ibuprofen Advil, it may be safe to take the medication while you're breastfeeding. However, it is important to talk to your doctor before taking any medications while breastfeeding. Your doctor can help you determine if Advil is an appropriate treatment for your condition and tell you what dose is best for you. You should also discuss how long you need to wait after taking Advil before nursing your baby again. 2. Types of Advil that are safe for nursing mothers. Advil, with its active ingredient ibuprofen, is generally considered safe for nursing mothers. There are several types of Advil that may be used while breastfeeding, including Advil liquid gels, Advil tablets, and Advil capsules. It is important to note that these products contain different concentrations of ibuprofen. Therefore, it is best to follow the instructions on the package or instructions from a healthcare professional when using any type of Advil while nursing. It is also important to consider the potential risks associated with taking any medication while breastfeeding. Some research has suggested that taking too much ibuprofen can increase the risk of gastric bleeding in both adults and children. 3. Monitoring the effects of Advil on baby from mother's use. When breastfeeding mothers need to take Advil, it is important for them to monitor the effects of the drug on their baby. This can be done by paying attention to any changes in the baby's behavior and noting if there are any signs of pain or discomfort after taking the medication. Mothers may also want to check with their healthcare provider regarding possible blood tests that could be used to detect levels of ibuprofen in the baby's system if they have concerns. Monitoring a baby's weight at regular intervals can also help assess whether or not Advil might be affecting him or her. Finally, keeping a log of when Advil was taken and any side effects observed in the infant can help track how well it is tolerated. 4. Side effects associated with taking Advil and lactation hormones. Advil may cause some side effects while breastfeeding, and they are largely related to how the medication interacts with hormones present in breast milk. Generally, these side effects include nausea, upset stomach, diarrhea, or constipation. It is important for mothers who want to take Advil while breastfeeding to monitor their babies for any changes in behavior or other signs that could indicate a reaction to the medication. In rare instances, more serious allergic reactions can occur when taking Advil while breastfeeding. If this happens, seek medical attention immediately. Additionally, if you experience any of the above-mentioned symptoms yourself after taking Advil while breastfeeding, contact your doctor right away. 5. Food and drug interactions with Advil and lactation hormones. Advil can interact with certain foods and drugs that you may be taking while breastfeeding. It is important to talk to your doctor about any other medications or dietary supplements that you are using before starting Advil. Some medications, such as birth control pills and blood thinners, can increase the levels of ibuprofen in the body when taken together with Advil. Taking both together could lead to an overdose. Additionally, foods such as grapefruit and cabbage can also increase the amount of ibuprofen in the body when taken concurrently. Therefore, it is important to discuss all potential interactions with your healthcare provider before taking Advil while nursing. 6. Strategies to avoid potential drug residue in breast milk. If you are still concerned about taking Advil while breastfeeding, there are a few strategies that can help reduce the amount of drug residue in your breast milk. First, if your child is younger than 6 months old, try to time the Advil dosage around feeding times. This means taking it at least 2 hours before feeding or 4 hours after nursing. Second, limit intake to 1 dose only during any 24-hour period, and take it with food or drink to minimize possible gastrointestinal upset. Third, if necessary, pump and discard your breast milk for several hours after taking the medication before offering it to your baby. Doing this will ensure that any remaining drug residue has been eliminated from your system. 7. Risks of not treating pain relief symptoms while nursing. If pain relief symptoms remain untreated while breastfeeding, the mother may experience fatigue, irritability, and depression. Not only can this cause discomfort for her, but it also affects her ability to care for her baby. In some cases, mothers can even be susceptible to more serious medical conditions, such as postpartum depression. Therefore, it is important to treat pain relief symptoms while breastfeeding in order to keep both mom and baby healthy. We hope this video has been helpful in understanding the risks and benefits of taking Advil while breastfeeding. Remember that it's important to consult with your doctor before using any medication, even over-the-counter ones like ibuprofen. If you have any questions or concerns about taking Advil while nursing, please leave them in the comment section below, and we'll be happy to help. Thanks for watching. Don't forget to subscribe if you haven't already so that you can stay up to date on all our latest videos.